See, white matter of the cerebrum, we have certain fibers which are called as association fibers. So if they are short in size, you call them as short association fibers. If they are long, then you call them as long association fibers. Okay, basically association fibers are connecting the cerebrum of the same side. Like if you are just taking the cut section of cerebrum, you are finding the sulci gyri. This is of the medial side of one half of the cerebral hemisphere. You are finding few fibers are small and they are connecting the adjacent gyri. Okay, they are the examples of short association fibers. Some of the association fibers which are on the same side of cerebrum, they are little lengthy. They are connecting. See, you have to check with this corpus callosum to identify which is anterior and which is posterior. Here we have rostrum. This is genu. This is body or trunk, and this is splenium. So that means this is the frontal lobe. This is parietal lobe. This is occipital lobe, and this is temporal lobe. So when you see the cut section of the cerebrum, you have this corpus callosum. Okay, that means here at the, what is this sulcus we have studied? This was the stem of lateral sulcus. Within the stem of lateral sulcus, if you just open up, I told you we have a hidden lobe called as insula over there. So here you have one more connecting fibers. You call it as uncinate fasciculus. Uncinate fasciculus. So we have superior longitudinal fasciculus. Okay. So what is uncinate fasciculus connecting which lobe to which lobe? Frontal lobe to temporal lobe, we have uncinate fasciculus. Okay, superior longitudinal fasciculus, check from where it is connecting. Is connecting the frontal lobe to the occipital lobe. Then inferior longitudinal fasciculus. It is connecting the anterior aspect of the temporal lobe to the occipital lobe. Just above the corpus callosum also, we have white fibers, okay, which are nothing but cingulum, cingulate fibers. So all these are the connecting fibers which are connecting the cerebrum of the same side. Cut section, if you check, they are not connecting right and left. If they are connecting right and left, you call them as commissural fibers. If they are connecting on the same half of the brain, you call them as association fibers. Okay. So short association fibers are these beta which are connecting the adjacent gyri, which are very small. You are supposed to draw these and give explanation in your own words. Okay, practice this diagram. So long association fibers, they connect more widely separated gyri to one another, whereas short adjacent gyri to one another. So what are the various things? We have uncinate fasciculus. Just now we saw it was connecting which lobe to which lobe? Frontal to temporal. Cingulum, it is seen above the corpus callosum. This is cingulum. Okay, superior longitudinal fasciculus. I told you, it is connecting the frontal to the occipital. Inferior temporal to the occipital. Fronto-occipital, the name itself indicates it is connecting the frontal to the occipital lobes of the same side. Remember this word, same side. Okay, because in case of other white matter fiber, instead of association, what are the other fibers we have? If they are connecting right and left sides, we call them as commissural fibers. Okay, so commissural fibers, these are the fibers which connect corresponding parts of the two hemispheres. Okay, if they are connecting, the largest commissural fiber is corpus callosum, isn't it? It is connecting right and left half of the cerebral hemispheres. You can see when you take the cut section of the medial section of the brain, corpus callosum you will see in the right half of the brain. Corpus callosum is seen even on the left half of the brain. What does it mean? That means corpus callosum is connecting right and left cerebral hemispheres. This is the largest commissural fiber of our body. Okay. So similarly, we have small commissures connecting. From the anterior aspect, we have anterior commissure. From the posterior aspect, we have posterior commissure. Okay. So at the level of fornix, we have one commissure. Habenular nucleus, these are all present in the deeper aspects, close to the midbrain area. Hypothalamic commissure. So based on, these are all very small in size, and largest among them is corpus callosum. Okay. So now, if you just look at this picture, exclusively corpus callosum is shown, and you are shown like where exactly the anterior commissure is present. It is actually present just behind the rostrum, connecting right and left, frontal lobes of the cerebral hemispheres. Correspondingly, Behind splenium, we will have posterior commissure. Close to the fornix, we have fornicial commissure. Okay, and the largest among habenular nucleus and hypothalamic nucleus will be below fornix area. So connecting right and left habenular nucleus, right and left hypothalamic region, very small commissural fiber will be there, which are named as habenular and hypothalamic commissures. Okay, like that we have many small connecting fibers, but largest among them we have is corpus callosum, which is connecting right and left cerebral hemispheres. Now let us see what are the parts it has. You can see here this is rostrum, which is continuing down as lamina terminalis. The bend is genu. This is trunk, and behind we have this splenium, also called as body. Okay, then so these are we know like corpus callosum is connecting two cerebral hemispheres, the genu, rostrum, trunk, and splenium. The fibers are the white matter fibers are actually connecting at the level of rostrum. Okay, at the level of body we have forceps minor. At the level of splenium we have forceps major. Okay, and there is one more connection more behind the splenium. Last part you will see tapetum. Okay, so these are all connecting fibers. They are given special names in corpus callosum. Okay, so actually the functional significance of corpus callosum is it is helping in coordinating activities of two cerebral hemispheres. Okay, so just to see, when you just see the corpus callosum from above, it is convex. From side to side, it will be concave, beta. Inferiorly also, it looks concave. And to the inferior aspect of the corpus callosum, we have a curtain like this. You call it as septum pellucidum. And if you remember me telling, if you cut this septum pellucidum, inside we will see lateral ventricle. Okay, I told you the white fibers of corpus callosum are given special names. Forceps minor, you can see it is connecting the, which lobes are these? Frontal lobes, right? Then this is the trunk. Here we have major fibers, which is seen towards the body and towards the splenium. We have forceps major. In between, whatever big white matter fibers which are connecting right and left half of the cerebral hemispheres, connecting right and left cerebrum, big fibers which are radiating, you call it as corona radiata. Okay. Apart from this, these projection fibers, now we have studied projection fibers in the form of ascending tracts and descending tracts when we have done physiology. That is the meaning of projection fibers. So which connect the cerebral cortex to other part of CNS. That means whether it is ascending tract or descending tract, what is the common area through which it has to pass? I said it has to pass through internal capsule. This is our internal capsule. So internal capsule, if it is ascending tracts like lateral and anterior spinothalamic tracts, they go in this way. That means they will enter first into retrolentiform, sublentiform part, posterior limb, genu, and anterior limb. Suppose if they are corticospinal tracts, okay, which start from the motor cortex of the cerebrum, they come like this: anterior limb, genu, posterior limb, retro and sublentiform part. That means whether sensory tracts which are ascending or whether motor tracts which are descending, they have to pass through this narrow gate. This narrow gate is internal capsule. This is also one of the part of the white matter of cerebrum, which is giving passage to the ascending and descending tracts. Okay, and we have also actually studied the blood supply of these tracts. And then I told you, if there is any blockage in these blood vessels, there may be large deformities, because it is a gate through which all tracts are passing, and if any tract is damaged, person will suffer with that particular paralysis, lesion of that particular area, whichever tract has been damaged. Okay, so that is like projection fibers are the fibers which connect cerebral cortex to other parts of CNS. So that is the brainstem and spinal cord. Example, corona radiata and internal capsule. See, this is, you are finding these are the ascending and descending tracts. The narrow gate through which it has to pass is internal capsule. Okay, we already did internal capsule in detail. So suppose if white matter fibers is coming, as I say, if you have already done internal capsule, after giving the information of commissural fibers and association fibers, you can elaborate your answer by writing internal capsule also. But you should check on your time, not so important. But if you remember that part less an internal capsule more also, that will also help you to score marks. But see that you do not exceed your essay for more than half an hour. Okay, beta? So that is all about this answer. What is the next question? Okay, radial artery. Cerebral artery. Okay, before I go to radial artery, because many cerebellum we did as yesterday, right? So I will take few more features of this cerebrum here, which we didn't discuss previously. So functional areas number we didn't discuss, right? So let me discuss that also. Okay. This picture gives good information how the tracts are passing via internal capsule. These are all tracts. This is the internal capsule area. And finally, it goes to the sensory cortex if it is ascending. So whatever points are not covered, I will cover them now. Okay. So now see here, introduction of cerebrum, surfaces, poles, and the Salsagere of all the surfaces we did, right? Once we are done with that, we will see functional areas of the cerebral cortex. So we have certain Brodmann's area, okay? So we have motor areas, sensory areas, and association areas. We will see with the help of diagram, we will see first and then we will come here. So now because we have studied what is this surface, superolateral surface. We know this is the central sulcus, precentral sulcus, isn't it? Then we have superior frontal gyrus, inferior frontal gyrus. Then we have superior parietal lobule, inferior parietal lobule, and superior middle and inferior temporal gyre. Then we have calcarine sulcus, superior and inferior occipital sulcus and gyrus. We have studied certain names in the when we were doing the sulci and gyre of superolateral surface. Now, precentral sulcus. The number of precentral sulcus is area number 4, and this is called as chief motor area. Okay, then there is a table better for you to understand this. I'll take you to table. See here, motor area, area number 4, which I have shown you, which is seen in the frontal lobe. Okay, so it is present in the precentral gyrus, and also when you see on medial side, we have paracentral lobule. Okay, so which is the paracentral lobule. If I explain you one center clearly, you will understand other centers. See, this area is paracentral lobule, this area number 4. Which view is this? Medial surface of the cerebrum. Okay, so this area is the precentral sulcus and this area is the paracentral lobule, which is occupied by area number 4. And see, our body's representation is upside down. What do you mean by upside down? Feet are seen on the medial aspect and head is seen on the down aspect of the cerebrum on both sensory area and motor area. This way of representation of the body on the brain is actually called as sensory homunculus. Similarly, for motor area also we have same homunculus. Body's representation is upside down. Foot up, head down. This representation is upside down. Okay. So similarly, we have motor homunculus also. Okay. Now we were talking about area number 4, where our body's representation is upside down except face. So this area number 4 is controlling voluntary activities of the opposite half of the body. And it is also controlling, like suppose if this area number 4 is damaged, what happens? See, because motor tracts are crossing. Do you remember they are crossing in the medulla pyramidal decussations, what we studied in physiology? So because 90% of the fibers will move to opposite side, that means right half of the cerebrum is controlling left part of the body, left half of the cerebrum is controlling right half of the body. That's the reason area number 4 of right side, if it is damaged, then person will suffer with contralateral paralysis and Jacksonian fits. Okay, beta? Then, now if you have observed in the frontal lobe, we have many other functional areas. What are those numbers we have seen? Area number 6 is there, area number 8, 9, 10, 11. And motor speech area. I remember this question also was asked. Motor speech area is in 2 marks question. You can see 3 marks question in our paper today. That is Broca's area, area number 44 and 45. Okay. So that is helping us in speech. That is the motor speech area. You have to talk about this. Okay. So like that, suppose if this area is damaged, what happens? Person will not be able to speak. That condition is aphasia. Okay. Like area number 44, 45, if you observe, it is present in pars triangularis and pars opercularis. These terms I have introduced you when I was doing sulci and gyre of superolateral surface. So for 44, 45 controls the spoken speech. And if this area is damaged, person will have loss of speech. That condition is called as motor aphasia. Motor aphasia. So similarly, in frontal lobe, we have many other areas like area number 6, 6, 8 and all. So like where they are exactly present, what is their function and what happens if they are damaged, everything is given. So learning this table will help you to answer your questions both in anatomy and physiology. So I want everybody of you to learn these tables. Frontal area, what are the functional area numbers, where they are located, how is the body representation, what is the function of that particular functional area, what happens if that functional area is damaged. Similarly, in parietal lobe, we have some more functional areas, and even in occipital lobe, we have temporal lobe also we have. Okay, occipital lobe, we have like 17, 18, 19. If you remember me telling you, like area number 17, I said it is area for primary visual pathway, isn't it? So area number 18, 19, I said it is concerned with visual memory. In the past, if we see and if we start recognizing now, you call it as visual memory. So if 18, 19 are damaged, person will have past things he won't remember. If he is seeing also, he will forget. This area number 17, that is responsible for homonymous hemianopia. The optic pathway I have explained you very clearly. So all these functional areas, I want you to learn better. So what you need to do now is, the simplest way is, for functional areas, for 2 subjects, this will help you. First, you do this area, superolateral surface, practice this diagram on the medial surface, and don't read anything theoretically. It's only time waste. On table you can convert into sentences. Okay, so that is. Rohita, did she join? But I didn't observe. Yeah. Rohita was asking yesterday. Yes, you can write in the form of tables better. And in case if you don't have time also, if you write in the form of tables itself, it will give you more marks. In fact, one diagram and table will serve your work. Out of, if it is 5 marks question, easily you will get 4 marks. If it is 15 marks question, if you are representing properly, you will get 12 marks also. So tables are always wonderful. It makes your explanation clear to the teacher. Okay, you can go with table, and if you have time, elaborate the table. If you don't have time, already 100 marks paper, skip and start writing your other answer. Definitely you will get marks. Okay, so that is. Because we didn't change the paper, I am taking as many questions as possible. Again, don't tell, ma'am, on the day you didn't take paper, it hurts me. Okay. So daily also I replace so many things, but despite of that, students talk in different ways. Thalamus we did in physiology, same part you can keep. Okay, medial and lateral geniculate bodies. Actually, these medial and lateral geniculate bodies are also very important. Especially lateral geniculate body diagram is very, very important, because I told you when we were doing optic pathway, See, from the optic chiasma and optic tract, you see the fibers are related to the lateral geniculate body. So in the lateral geniculate body, that means we have nasal fibers which are coming from the opposite side. We have temporal fibers coming from the same side. So from the same side, whichever are shown in pink color are the temporal fibers, and whichever are shown in blue color, they are actually the nasal fibers. Link may go and you please join fast. So for lateral geniculate body, this actually carries the optic fibers. This is concerned with the mechanism of what? Vision. Okay, so that is about lateral geniculate body. So it may come for 5 marks or 3 marks question. Small oval elevation situated anterior. I have discussed this as carpora. That is different. Superior colliculus, inferior colliculus. Then I told you lateral geniculate body is actually connected through superior brachium to the like lateral geniculate body. Midbrain will have those connections. So 6-layered structure, just now I have shown you. Pink and blue. Okay, contralateral means opposite side, ipsilateral means same side. Okay, so layers 1, 4, 6 are nasal fibers which are coming from opposite side, 2, 3, 5 are temporal fibers which are coming from same side. Okay, so connections, we have optic tract,